Hey everyone, how you doing? So today, let's talk about gum recession and more importantly, what can you do about it? So my name's Gers, I'm a cosmetic and implant dentist based near London in the UK, and today I'm going to share with you the thinking behind rebuilding gums. Okay, now we can't do it in every single case, so the first thing I'm going to talk about is which cases can you do it and which cases can't you do it. So I've done another video about the 5 main causes of gum recession. And without a doubt, the biggest cause is gum disease. And when we're looking at any kind of rebuilding treatment, whether it's implants or veneers or whatever it is, or gum surgery like we're going to talk about today, we have to ensure that all the disease has gone. So this means no gum disease and this means no tooth decay. Okay, so luckily these two things, with the right advice and the right kind of techniques, are usually quite easy to get under control. And once you have these under control, the gums often shrink back a little bit. Okay, so here's a photo of a guy who came in, he wanted to improve the look of his smile, and you can see that the gums look really irritated and red. So we can't do any veneers until the gum disease has sorted itself out. So we went through a course of gum treatment, the gums shrunk up because during the gum disease they were all inflamed, so they all shrunk back and it revealed these ugly black triangles between the teeth. So I'm not going to talk about black triangles so much today, I'll do another video on that, but this is an example where once you treat the gum disease, all the inflammation goes away, and quite often things can actually look a little bit worse than when we started. Now, let's talk about those cases which we can treat the gum recession for. So recession is this, okay? So you can see in this photo the gum is much higher on one tooth than it is on the other teeth. And this can be caused by either gum disease, or it can be caused by aggressive brushing, or people who've got very thin gums or have got very delicate gums, so their gums tend to recede a little bit more quickly. Now, the problem is there's not enough thickness of gum. Okay, a lot of people think that there's a problem with the height of the gum, and it is the height of the gum, but the reason that the gum has shrunk up is because it was thin to begin with, and something like gum disease or over-aggressive brushing or orthodontic treatment or some kind of other factor has come in, and because the gum is thin to begin with, the gum has been weakened and it shrinks up. Now, the way that we can differentiate whether it's something which is treatable and something which is not predictably treatable is that by looking in between the teeth. Okay, so in this photo, you can see that the gum goes all the way up in between the teeth, but on this photo, which is a different kind of disease, the gum has shrunk between the teeth. So we've got these big black triangles and gaps between the teeth, and the gum looks much more flatter. So what this is actually telling us is, has the bone between the teeth been lost? And if the bone between the teeth has been lost, it turns it into a much more complicated situation compared to if it's something like this, where there's loads of bone between the teeth and the gum in front of the tooth has been lost. So I'm not going to talk about those situations where everything's been lost, because that's aggressive gum disease, and I don't know of a really good way that we can rebuild a bone like that. Okay, so let's now focus to what can you do if you've got this gum recession and we've got these bony peaks between the teeth, right? The simple answer is some kind of tissue graft. Okay, so a tissue graft is where we take gum from somewhere else in the mouth. It's usually the roof of the mouth, and it can be near the front and the back. Okay, and there's different qualities of gum. So if you speak to a periodontist, and this is the kind of dentist who you need to see about this kind of stuff, is a periodontist, and they'll be able to look at the defect. Okay, the word we use for this is a defect, the gum recession, and advise on the best type of tissue graft, right? And there's tens of different types of tissue grafts and techniques available. And essentially what you're doing is taking good gum from somewhere else, the roof of the mouth or the back of the mouth or somewhere at the bottom, and taking it and putting it underneath the existing gum and stitching it all together and letting it take in that position. Okay, so the good advantage of this is there's nothing foreign being introduced. It's all your own stuff, and we know that this works quite well. There's a whole bunch of things that need to be taken into account for this, but let me show you exactly what we did for this case that I showed you at the beginning. Now, this lady wanted to improve the look of her smile as a whole. And when you're looking at a smile, you need to get a couple of things, really important sort of markers to improve the look. So the bottom of the teeth have to be in a nice arc, it has to follow the lower lip line, and then the tops of the teeth have to be nice and symmetrical, and the arch that the gum makes above each tooth has to be right for that particular tooth. Now, the problem was the gum is too high on this side, whereas on the other side the gum's not too bad. I've got a feeling this lady was left-handed, and when she was brushing her teeth, she just put more force on one side than the other, and that's what caused the gum recession. So what we did, we lifted the gum, okay, being very careful not to break the gum in between the teeth. Okay, this is really important. If we want any of this kind of stuff to work, any kind of bone grafts, bone grafts or tissue grafts like this, then it's all reliant on the amount of good quality blood supply in the area. Okay, so we do a special kind of what we call incision to lift the gum, but not breaking any kind of contact with the gum going in between the teeth. Then we take the gum from the roof of the mouth, we thread it underneath, okay, and I'm going to show you what this looks like straight away afterwards, and this is what we end up with. It looks horrible, and a week later it doesn't really look much better, but it's going in the right direction. But give it enough time and then we actually get good quality gum around the teeth again. Okay, and all we've really done is increase the thickness of the gum. By increasing the thickness, we've got good healthy gum, we've got good blood supply in the area. And then we went on to improving the look of the teeth with porcelain veneers, and that's how we got this, lovely harmonious result. So these kind of tissue grafts are really common when we're doing implants at the front of the mouth, because again, we have the same problem. When the tooth is removed, the gum shrinks back and we lose the thickness of gum in that area. So we have to do bone grafting and tissue grafting.
Hello guys, Marcella here. How things going today? Guys, if you're here, it's because you want to know if Dentitox Pro really works for everyone, right? So today I've decided to record this video to tell you why Dentitox Pro gives results for many people, but not for others. Guys, I'm tired of seeing so much wrong information on the internet that I've decided to tell you what really happens with this product, because Dentitox is making a huge noise on the market since its launch. So if you don't want to lose your money, stay with me until the very end of this video, right guys? Guys, have you ever wondered why some people say they're not getting results with Dentitox Pro? Believe me, it is simple. It's because they're buying the fake product from random places instead of the real deal. Listen up guys, the original Dentitox Pro is only sold on our official website. That is so important that I even dropped the link to the official site right here in the description of this video for you. So just go there and you're safe, okay? Okay guys, Dentitox Pro works, don't worry. And what brings even more peace of mind is knowing that it is FDA approved. And when you buy Dentitox Pro from the official website, you get a 60-day money-back guarantee. This is awesome. That means if you try the product and feel like for any reason at all, it's not for you, you can just ask for a refund and they will give you all your money back. This is a detail that really puts me at ease with Dentitox Pro. Now guys, Dentitox Pro helps to eliminate inflammation to your gums, and gum inflammation is one of the main causes of damage and bleeding gums. So if you do suffer from sensitive gums or sensitive teeth, Dentitox will help you guys to completely restore that, Also, Dentitox removes plaque and bacteria from the teeth and gums, and bacteria can cause really bad inflammations and it can lead to really bad breath as well. Basically, guys, Dentitox Pro has all the correct nutrients and proportions to help you guys improve your overall health. So, Dentitox Pro comes in liquid form and it comes with a liquid dropper. And all you need to do is place a few drops on your tongue in the morning. It is best in the morning because, it will help you guys to have more energy as well. So place a few drops on your tongue in the morning and just do that every single day. And you will see great results in no time as well. And guys, since Dentitox Pro is a natural supplement, it has no side effects and no contraindications, meaning that anybody out there can use it. Dentitox Pro has many benefits, but if you guys really want to use up all of those benefits, it really depends on you, because you need to take your treatment seriously with Dentitox Pro. And that's it. You can trust that if you're committed to your treatment, you will definitely see excellent results. Just give Dentitox Pro a chance and you won't regret it. Now guys, if you want to know more about Dentitox Pro, visit their real website. The official link is